A pelvic organ prolapse is when one or more of your pelvic organs loses some of its normal support, changes position and pushes into the vagina. This can be your bladder, your bowel or your uterus, or a combination of the three. You may have been told that you have a rectocele, a cystocele or a uterine prolapse. A rectocele prolapse is when your bowel loses its normal support, changes position and pushes into the back wall of your vagina. The other symptoms you can have with this are increased constipation or trouble emptying your bowel. A cystocele prolapse is when your bladder loses its support, changes its position and pushes into the front wall of the vagina. Other symptoms you can have with this is increased frequency of emptying your bladder, struggling to empty your bladder or even incontinence. A uterine prolapse is when your uterus uses its normal support and drops down into the vagina. Clinically, we categorize prolapses into grades. However, we know from experience that these grades do not always correlate with the symptoms you are feeling. For example, you could have a clinically high grade prolapse and no symptoms, or you could have a clinically mild prolapse but be very symptomatic. Having a prolapse can be very distressing, but it is important to remember that there are things that you can do to change your symptoms. There are various reasons why prolapse may develop, but it's always due to reduced support. Your pelvic organs are supported by connective tissues and the pelvic floor group of muscles. Some activities can increase the pressure on this area, and these can contribute to a prolapse. Common things that contribute towards having a prolapse are pregnancy, giving birth, straining whilst constipated, previous gynae surgery, fibroids, persistent heavy lifting, persistent coughing, high impact exercise, weight gain, or a combination of these factors. Everyone is an individual and affected differently by all these different factors. In addition, as we age, there's a natural reduction in muscle strength, and there's also a hormonal change during the menopause. And this can have an impact on that support system, making it more likely that you may have a prolapse. Not all prolapses are symptomatic. However, you may experience one of the following common symptoms: lower back pain, a feeling of heaviness or a bulge in the vagina, incontinence of bladder or bowel, difficulty opening bladder or bowel, pain or discomfort during intercourse, or needing to pass urine more frequently. The good news is you can strengthen your pelvic floor muscles and therefore increase your support system around the pelvic organs. There are some simple exercises you can do to strengthen the pelvic floor. To see these exercises, please see our female pelvic floor educational video. It may take 6 to 12 weeks of persistent pelvic floor exercises before you see any difference in your symptoms. This may seem like a long time, but it's important that you persevere with the exercises because they can make a substantial difference to your symptoms. Yes, exercise is really important, and appropriate exercise can help improve your symptoms. However, there are some exercises and activities which will increase the pressure on your support system and your pelvic floor. It is advisable that you avoid these activities and exercises whilst you're still strengthening your pelvic floor until it is strong enough to withstand the extra pressure. If you find that you're more aware of your symptoms or they're getting worse during a certain activity or exercise, it is important that you modify this exercise to relieve the pressure on the pelvic floor. Consider these common activities which can increase the pressure. High impact exercise, for example, running, jumping or HIIT exercise. Could you replace these with Pilates, swimming, cycling, yoga or other low impact exercises? Heavy lifting. This could be carrying your food shopping home, could be moving furniture, or even lifting weights in the gym. Can you change the activity so you're putting less pressure on your pelvic floor? It is important to be mindful of your symptoms. If something is increasing your symptoms or you're more aware of your prolapse, this is something that you need to modify. Lastly, breathing. It is important that you breathe throughout exercising. Try to breathe out on exertion. Other tips to improve your symptoms. Avoid long periods of standing. Try to pace yourself. When you feel you've been standing for a long time, move around or have a sit down if you feel necessary. You could even do some tasks in sitting, like chopping the vegetables or the ironing. Avoid constipation. We know that if you strain whilst you're constipated, this can worsen your prolapse symptoms. If you need any tips on how to manage constipation, you can watch our Healthy Bladder and Bowel Habits video. Weight management. Weight management is important for your health in many ways. We know that if you are overweight, this can worsen your prolapse symptoms. There are many resources on the NHS website for weight management, and if you're struggling, you can contact your GP for further help. If sexual intercourse is uncomfortable due to your prolapse, try different positions until you find one which is comfortable for you and your partner. If you're experiencing vaginal dryness, especially if you're postnatal or menopausal, use a good vaginal lubrication. We appreciate that these symptoms can be very bothersome and overwhelming, but try to remember the majority of people who do this will have a reduction in symptoms, and the majority of them will have a complete resolution of their symptoms. If you feel like you need any further advice or an assessment of your pelvic floor, please contact your GP and they'll be able to refer you to your local pelvic health team.